Okay, welcome. Today is Friday, May 1st. Can you believe it? May 1st. Wow. Um, so what I want to do today is continue our discussion on the COVID-19 testing. Um, this is a follow-up from the presentation I did a few days ago. Since then, people have been calling our office or texting, just wanting to know, should they get tested? If so, where should they go? Should they go to Quest? Should they go to LabCorp? They're all confused and anxious to get the testing. And I understand, but what I want to do is just kind of go through this with you, re-explain a few things and kind of lay some light on what the test really means. And really where I feel is where we should be putting some emphasis and some importance. So COVID-19 antibody test. What should I do? What should I do that now that I'm hearing that the test is available? It's all over the news. And what does it really mean? So let's just refresh ourselves a little bit on the testing, right? So remember, we spoke about the PCR testing. That's your nasal swab, right? And that purpose of that test is really, am I infected? That the PCR testing is determined active infection. Right? And we said that there are a lot of potential flaws with the PCR testing. There's human error, but because of the mechanisms of the PCR testing, there's oftentimes false negatives and sometimes even false positives. So they are trying to get better with that, but it does come with some error. Roughly right now, about a 20% error. What we're really interested right now is the antibody testing. Everybody's been waiting for the antibody testing, myself included, honestly. And it is a way forward, but if you recall from the previous talk that we had, the real benefit is like the antibody testing along with the PCR testing. That's going to give a stronger confirmation of whether you were infected, and if so, how your body is responding to that infection. So the antibody testing is a blood draw. We did speak about the dried blood spot. You prick your finger. Okay, that test is not available yet. Right now, it is only a blood draw test. The purpose of this testing is just going to be an indication of what phase of the infection are you in. And mostly is, have you acquired? Do you have immunity? And we spoke and we said that still we don't even know what that really means. We don't know if it's long-term immunity or if it's short-term immunity. If we look at a common cold, which is still in the family of a coronavirus, right? Your immunity isn't that long. You can get reinfected very easily. If it follows the same path as the SARS-CoV-1 epidemic back in 2003, that one we're showing to have longer immunity. So we're 17 years past that, and people still are showing IgG antibodies against the COVID-1. So we're hoping that that's the immunity that we're going to be building, but we still don't know. School is out, and you're not going to know until a long time, right? So this was just released. Let's just go through this, right? Quest and LabCorp launched nationwide coronavirus testing ahead of FDA review. Neither company's test has yet received an official authorization from the FDA. This was today. This is today. This is not yesterday. But the agency is allowing antibody test developers to proceed without review with a few caveats. The test's accuracy must be validated by the company, and they cannot be used to diagnose COVID-19 infection. The antibody test cannot be used to diagnose a COVID-19 infection. Okay. Well, it's not intended to do that. It's really intended to understand whether you've built immunity or not. In addition, both LabCorp and Quest stated that a positive blood test result alone is not enough to confirm that a person is immune to the novel coronavirus. It is not known what antibody levels will provide protection from infection or for how long, but these test results can still provide some information on how far the disease has spread. That's really the purpose of the test, right? Is to see, have people been infected, not had any symptoms or mild symptoms, not even sure if they were infected, And if they tested positive for the antibodies, then we know that there's a lot more people that were infected, but a lot more people didn't have a response, so it changes all the percentages, right? While the science on COVID-19 is evolving, testing for antibodies may identify people who have likely been exposed to COVID-19 and might have mounted an immune response to the virus. Congress urges FDA to better police, evaluate the COVID-19 antibody test. Members of Congress recently called on the FDA to reevaluate its relaxed stance toward COVID-19 antibody testing, and it urged the agency to clamp down on unauthorized tests, some of which promise to allow people to return to work safely. So again, the concern is, do we get a false interpretation that we're all good to go because we have a positive antibody and now we can just go back into the world and we're all safe and stuff. So that's the concern. Is they want to make sure the FDA that the antibody testing is efficacious enough that we can re-enter the world properly, right? Not rush to judgment here. However, the accuracy of many antibody tests on the market has been called into question, including by a group of Oxford University researchers. Meanwhile, the FDA has teamed up with the Center for Disease Control and Prevention and the National Institute of Health to validate antibody tests voluntarily submitted by companies for review, with the first results previously expected in the coming weeks. So let's just refresh on some of the things that we spoke about a few days ago when it comes to testing. Right, excuse me. So we have both the IgMs and IgGs, the antibodies. We have IgA antibodies, which is the barrier system, and we have the IgMs and IgGs. Okay, your infection rises and falls, okay, for the most part in a 28-day cycle. And if you remember that the IgM is the early antibody, so it really follows the same trajectory as the infection. So it's rising and falling simultaneously with the infection. So it starts early on and around day 7, right? So we have the onset of symptoms around day 5, right? So maybe about 5 days asymptomatic, but you are infected. Around day 5, you become infected. 2 days later, the antibodies are kicking in, early onset. And then they start to decline around day 14. It's around day 14 when the infection and the IgMs are declining that the IgGs start their trajectory. So the IgGs can come on the later end, hitting their peak somewhere around day 24 before they start to drop off. Again, it's the IgG that is of interest because this is the antibody for long-term immunity. Okay, whenever you're checking, if you have a blood test and you're checking antibodies for previous infections, it's going to be an IgG test. Okay, so that's really where a lot of the emphasis is on that IgG. So this was a graph that we showed you before. Let's just run through it again for clarity. You know, repetition is important. All right, so it's showing you here clinical significance. So this is interesting, right? Because if a person gets the antibody test and it comes back negative, the lab in this case runs both the IgM and the IgG, and it comes back negative. What's the meaning? How do you interpret that? Okay, well, if they had the PCR testing that tested positive, okay, it could indicate that the patient is in the early window of infection, that first 5 days of infection. Right? Now, if you don't have the PCR testing, and most people don't, so if you're just going out and you're getting the antibody test and you haven't been tested, you haven't been swabbed, and your antibody test comes back negative, what does that tell you? Who knows, right? Because possibly this is the existence. So just because you tested negative doesn't mean that you're not infected, theoretically. Okay. Now I would just to say that obviously if the test came back negative, and 10 days have gone by and you're asymptomatic, then probably no infection, and you have not been exposed in the past, and so there has been no antibodies, so you've had no exposure. So A lot of ways to interpret things, right? If your antibody test comes back and you have a positive IgM and you're negative on the IgGs, what would that mean? Okay, it could be that there's an early stage of infection, right? Let's forget about the PCR component because most people have not been tested by the PCR, right? It's only the people in the front lines, basically, that have been tested. If you have an IgG and an IgM antibody, that would mean that the patient is in the active phase of the infection, right? The IgMs, the IgM is still high enough, and this is going on, so you're still somewhere in this range. Here, the patient has a negative IgM and they have a positive IgG. In this scenario, the patient also had a PCR testing, so they tested the PCR testing shows they have the infection. Again, it's not 100% foolproof, but the antibody test shows positive IgGs, right? So they're going to be past the early stage. They're in the latter stages because you have the antibody. So this antibody test, along with the PCR test, would give you confirmation that this person was infected and the PCR test was reliable in this case, and then therefore they're in the later stages. Again, we don't know how long that immunity is going to last, but that's what it represents. If you did have the PCR testing done and it was negative, but you do have a positive IgM and a negative IgG, right? That could indicate that this might have been falsely negative and you're in the early stage. If you had a negative PCR testing, okay, and a negative IgM testing, and a positive IgG testing, okay, the patient may have had a past infection and has recovered. So in other words, if you're getting the PCR testing and it's negative, is it falsely negative? Well, if you have a positive IgG, then either it's falsely negative and or you're so far past the infection that the PCR testing is not picking it up, but the IgG is positive, so you have immunity. Okay? And in this case scenario where it's a negative PCR, positive IgM, positive IgG, okay, the patient may be in the recovery stage of an infection or the PCR testing might have been a false negative. So again, the point of going through this is just to show you that there's a lot of scenarios. So the question is, if I go out and I go to Quest, I go to LabCo, wherever I'm going, and I want to get the test done, and I get the test done, you know, what does it mean? And how do you interpret the results? And how do you move forward? How do we collectively all move forward with the results of this test? And depending upon where you go is some labs are running the IgMs and the IgGs. And there are some labs that are not running IgMs, they're only running IgG. So again, if you only run the IgG, fair enough, because their only interest is in, and you understand if there's long-term immunity. But you also may need to be looking at the IgMs to tell us if the PCR testing was falsely negative, falsely positive. So I got tested, got some results. Now what? That's the question. What are you going to do with those results? Well, I'm not saying not get tested. I would like to get tested, okay, when the time is right, when it's FDA approved, when we know the test is, when we have the validity of the test. But what am I going to do? What do you do with the results of that test? Now, I guess, if my results come back and I have a positive IgG and a negative IgM, and I have not had the PCR test, I haven't had any symptoms, really. So it's plausible that would be enough. Well, I could say, okay, well, I must have been infected. I got the antibodies. I'm past infection. I hope the IgG is going to give me long-term immunity. I don't know. But I guess it can help me to sleep better at night. Okay, kind of put my head in the pillow and feel a little more relaxed. That hey, I actually got infected. I didn't get any really bad symptoms. My immune system was pretty good. Now I'm on recovery. Okay, but it doesn't rest assured that I cannot get reinfected. So maybe that's the benefit. Um, the truth is that the antibody testing, the results are really for the scientists. It helps to better understand the virus. Think about it, right? So as scientists are studying the virus and they're trying to get a better understanding of its spreadability, they're trying to get an understanding of the seriousness of it, the reinfection rates, the exposure, the volatility of being reinfected. You know, this is all going to take a long time, not weeks, months, you know, plausibly even a year or so before they really get it, before these lab finds are giving the scientists a better understanding of how this virus is operating and what treatments, okay? You know, again, they are, I don't want to get too far into that today about, you know, treatments. This is not really a discussion on the quinine, hydroxyquinine, and or the anti, you know, pepsid, pepsid medications. But here's what I really want to go to. Here's what I feel is like, I look at testing from the standpoint of non-actionable testing versus actionable testing, okay? Empowering testing. So from my perspective is the antibody testing is valuable from the standpoint of it's going to help with research. It's going to help scientists get a better handle on the virus. Maybe it can make you put your head on a pill and sleep at night. Some people who have tested for positive antibodies may be able to contribute, for plasma donations. But really, what does it really do for you? And is it going to prevent you from getting infected again? Because we don't know. Actionable testing, however, puts us in the driver's seat. Actionable testing, is allowing us to be more proactive, not only so that we can prevent the infection from reoccurring, okay, but from downregulating just a total, inflammatory cascade, and the serious consequences that come from becoming infected. So the questions are, actionable testing. How is your lung barrier system? Is there a breach in your lung barrier system, making you more susceptible to a heavier load of viral infection? You've heard of viral load, right? They're trying to understand why some people are affected more seriously than others. Now, we did go over all that in the last presentation. I don't want to hash that again. But one component is viral load. Now, certainly people who are on the front line, who are being exposed to the virus every day, to some degree, potentially have a heavy load. Right? So we know that if your barrier systems are intact, if a few get through, the load is less. If you lose your barrier systems, more viruses get through. It's just, it works, and the load gets heavier. So is your lung barrier system in check? Is your gut barrier system in check? Right? You know that the virus is also in the gut, right? They talk about viral shedding in the gut now. In fact, the research is now telling us that they are now seeing that upwards of 5 to 7 days after a person who's been infected is non-symptomatic, you're 7 days past symptoms, you think you're well on your way, but for those 7 days, the virus is still shedding in the GI system, which is why they can be, fecal contamination. Do you have an intact brain barrier system? If there is inflammation in the body, if your immune system is reacting to the virus and it's driving inflammation, those cytokines. Okay? If your brain barrier is not intact. Your blood-brain barrier is breached. Just like you get a leaky gut, you get a leaky brain, right? You're going to have an inflammatory immune response in the brain. Doesn't sound like fun, right? So what's your secretory IgA levels? Remember, the IgA are antibodies that predominate in your barrier system. This is your front line defense, protecting you from the outside world. So the viruses have to work their way past your lung barrier, your gut barrier, your blood-brain barrier. Right? If you have an intact IgA, right, your defense is up. This is not being measured. IgA levels are not being measured in Quest and LabCorp. They're only testing IgMs and IgGs, and in most cases, just the IgG. So the testing is just for post-infection immunity, okay, which is still questionable. It's not measuring this. So if a person's IgGs are dropping, or it's not as robust in the sense of it's not going to give us the long-term immunity that we want, and we have re-exposure, right? We're concerned about the re-exposure coming in early fall, right? If your IgA levels, if your barrier systems are weak, infected again. So we have the opportunity to do this. Let's check this. If it's low, if it's weak, let's start to build this up. Let's build up those barrier systems. 80% of your immune system is in your gut. You think it would be a good idea to take a look at the health of our guts, to put some attention to gut integrity, to our gut immune system? Again, barrier system, quite important. And how about your stress glands, your adrenal glands? How are your stress glands doing? Right? Stress is going to drive an increase in the stress hormone cortisol. We've all heard that. Cortisol is our survival hormone. So when we're under stress, we're going to stop surging cortisol. What is cortisol going to do? The increase in cortisol is going to suppress IgA. So your stress response, chronic stress response, is going to weaken your barrier system, making you more vulnerable, more susceptible to infection and to a heavier viral load. If secretory IgA goes down, your barrier health weakens. All right, this is the picture we showed you last time. These are your epithelial cells. Epithelial cells are your barrier cells. These are the cells lining your lungs, your respiratory system, your GI system, epithelial cells. Right? On top of that epithelial cells that are connected, right, is you have a mucosal lining, the outer and the inner mucosal lining. And this is where your antibodies, the IgA antibodies, are residing. So when a virus comes in, the coronavirus comes in, these antibodies can bind to them and neutralize them, and prevent them from getting inside, and we can slough them out. Right? But when we have a weakness in that mucosal barrier, when the secretory IgAs go low, and we just said from the previous slide, what's going to allow the IgAs to go low? One of the major factors is going to be stress. So the chronic stress, the chronic surge of cortisol, is going to lower the barrier system by lowering IgAs and allowing more viruses to penetrate in, a heavier viral load, and eventually these cells become sick and they become destroyed. The viruses burst out and contaminate more healthy cells. So when I say stress, stress is a lot of different things. So we have the stress of just dealing with this, right? But another common stress is going to be blood sugar dysregulation. So there's your connection between patients with diabetes having a higher morbidity rate with this virus, right? Because blood sugar instability is a physiological stress response, and it's going to impact our cortisol. So as your blood sugar dysregulates, so goes your cortisol. And so now you have a connection between blood sugar dysregulation and breaching your barrier systems, creating this infection. So it's why it's important during these stressful times, right, to control your blood sugar. So unfortunately, people eat emotionally, and we turn to those starchy, simple carbohydrates. right? And we're throwing our blood sugar into disarray, which is contributing to the breakdown of our IgA and mucosal barrier. Right? So it's really important that you stabilize blood sugar, and that's what we talk about in your diet, and a non-inflammatory diet. So that's intestinal permeability, called leaky gut, right? So whether this is your lung fields that are breaching, or whether it's your gut, that's your leaky gut or intestinal permeability. Okay. With intestinal permeability, the barrier is broken down and intestinal contents can enter into the bloodstream. The coronavirus can now enter into the bloodstream. And what happens if there is a breach in the blood-brain barrier? Where's the coronavirus going to go? It's going to go to the brain. And you hear about young people having strokes. Why? It's going to the brain, right? In some cases, the person doesn't have a stroke, but they can have residual effects, right? And that'll lead to some serious neurocognitive, neurodegenerative demise. So, in the context of it all, when we think about going to LabCorp, Quest, whatever lab is going to come up with the antibody testing, it's important, but for your health and your well-being, what do you think is more important? What do you think is more actionable? What are you going to do with the antibody test? If you have a leaky gut or a leaky brain or a leaky lung barrier, what's the antibody test going to do to fix that? Nothing, right? But if you come in with some functional lab testing, perhaps a salivary, a saliva, adrenal profile that looks at the mucosal layer or the IgA cells, right? You get an understanding of how intact your barrier system is, and do I need some adrenal support? So that's a wonderful test, right? The mucosal immune reactivity screen is a little bit more comprehensive. It looks at the IgA cells, but it also tells us if there is a leaky gut and a leaky brain. So we better start taking some action steps to correct that now, right? Organic acid test, it's a urinary test. It looks at oxidative stress markers, right? That would be things that could cause damage to your cardiovascular system. If you have oxidative stress markers that are elevated, right, you're way more susceptible to more serious complications from the infection than if you don't have oxidative stress. Okay, other infections in the body that is driving your immune system, so that if you get the virus, you have an appropriate response, or your immune system is just too tired because it's dealing with other infections. You lack the nutritional needs that your immune system requires to function properly. And what about a gut microbiome test? Why not just look at the integrity, measure the secretory IgA cells in your gut? So the saliva test looks at IgA cells that's in the oral cavity, and for some part, your lungs, but it doesn't represent the IgA in your gut. A stool test looks at the IgA in your gut. So you can have an intact or healthy IgA response in the oral cavity, so the mucosal barrier is more protected there, but we know that the virus can also go through the GI tract, right? Penetration that way. So if you have a weakness in your IgA in your gut, you can still get infected that way. And so a gut test is also a really, I would say, quite a valuable test. And people often ask me, and I think certainly genetic testing. Why would you not think about genetic testing? Now, I get it. Maybe you don't want to do all these tests at first. They could be expensive. And you need to kind of maybe make a decision based upon individual needs. But genetic testing, are you, from a genetic perspective, we're all different. And some people genetically are going to be more prone to inflammatory immune responses than others. But if you know that, then you can intercede and take strategic plans to override that. But without the testing, you don't know where your weaknesses are. Right? In my own personal case, right, my genetic test shows that I have, a tendency to drive more inflammation than the average person. That's just my genetic makeup. Fair enough. And also in my genetic testing show that I do not methylate very well. Now, I know some of you don't know that term, and some of you do, but the most easy explanation is methylation is an on-off switch. I'll leave it at that. But most, I would say 70% of what it does is it acts more as the off switch. So my methylation process is not great. I have about a 65% genetic weakness when it comes to methylation. So my off switch doesn't work so good. So if I have inflammation going on and I don't have a good off switch, I can't dampen that inflammatory response. That's just genetically. So what do? Right? I take things and I control my inflammatory cascades. I make sure I have intact barrier systems. I make sure I have a balance in my immune cytokines through just targeted nutrition and lifestyle. And I take methylation support. That's the whole point of the testing, is you can override the weaknesses with targeted intervention. So knowing that, I'm ahead of the curve. So now I'm correcting my genetic weaknesses, and I'm putting myself in the driver's seat. So again, that's why these tests can be so important and so impactful. So again, here's our, if you want to contact us, all right, this is our email contact, Dr. Pucci at getwell-now.com. Right, we're offering a free discovery call. So many people listening to this are not active patients in the office. And so that's why we're offering to you as a free discovery call, about a 20-minute phone call where you can discuss with us your concerns, your health issues, and we can help maybe make some suggestions or direct you into what testing or tests would be beneficial to you. Okay, certainly based upon your monitoring needs also. So let's discuss what tests might be right for you. And again, I want to just thank you for your time in listening to this. I hope this does clarify some of the interests and concerns of the antibody testing. I am not dissuading anybody from getting that test. There is value to the test. We really all should get that test, so it does help us as a society to understand better about the virus. But again, the test itself is not doing anything to improve or protect you from potential reinfection or severe reinfection. So again, thank you. Reach out to us. We'd love to hear from you. And as always, with new information, we'll be back. I'll be back sharing that with you and trying to give you some insights into what we're doing. Okay. Talk soon.